know that most of the doctors are really dedicated to the medical field. So the age doesn't stop them practicing. But this is the time when we really have to think about ourselves because we are very important. Doctors are the most important species on this earth, which have to be preserved, and and it rightly belongs. That responsibility rightly belongs to us. So anyone above the age of 65 years, I would say, rightly not to practice with the underlying diabetes mellitus, chronic liver disease, heart disease, chronic lung conditions like asthma, COPD, cancer, any pregnant women, and seropositive status cases. And they're very highly uh, uh, chances of contracting the COVID-19. Hence, it's better they don't practice. Anyone with a travel history in the last 28 days and anyone suffering from cough, cold, and fever, better not to practice. The patients whom we should avoid for treatment at the clinic are all symptomatic individuals who have undertaken international travel in the last 28 days, all hospitalized cases in the last 28 days, all individuals who have come from a hotspot areas must be tested first. All healthcare workers in the hospitals who are symptomatic and patients with active fever, cough, cold, and malaise and diarrhea are to be avoided for our own safety. Then, what is must for all staff? Triaging. We need to also triage the staff before they resume their duties. At the end of this presentation, I have given a set of questions which we really have to ask even the patients and the staff so that the risk of exposure to COVID-19 to every one of us is less. So we need to also make sure most of our staffs are having the personal protective equipment and also the flu vaccines or the COVID-19 vaccines once they're easily available. So the hand hygiene is one such very important aspect which also have to be trained to the nurses or the other healthcare professionals in our clinical setup. So when it comes to the clinic setup, what are the things which we really have to take care or look into the modification aspect while practicing during the COVID-19 period? So the patient waiting area is very important one, which we really have to look into. The consultation room is really important again, and the patient treatment area or the laboratory and the pharmacy also we have to look into. So let's see what can we can do in the consultation room. Definitely, if it is a luxury, we can have the negative pressure or the AIR rooms, that is the airborne infection isolation rooms for consultation, or use an HEPA filter if we are using air conditioning. The other thing also that can be used is the UV light, which is reasonably commercially economical. Okay, so let's see what is that negative pressure room doing. The negative pressure room tries to keep the air out of the room all the time. So whenever there is negative air, the air tries to enter in. At the same time, it is trying to push out. Okay. So the patient treatment area, it should be cleaned after every session during the I mean using a disposable cloth or a if the area appears to be even if the area appears to be uncontaminated, we have to do it at every session. The look work surfaces, the patient chairs, doors, and handles also have to be cleaned at every session. And also, we need to see that we need to clean the weekly intervals, the window blinds, and the accessible ventilation fittings, and the shelves in the cupboards. The patient waiting area also need to be clean. That is the front office. The manager, I mean the washroom has to be fumigated, the sanitized. We need to sanitize the pen every time we use. Okay, and it is very simple thing, but also very important. And in the front office, the manager should wear the mask and the gloves. And also, we should try to provide some protection in the form of a glass or a plastic sheet in front of their desk so that that becomes a protective layer from the patients, probable patients of COVID. In the patient waiting area, we have to definitely provide a hand washing and the soap and the water. There is, we need to provide disposable tissues. Anything which cannot be disinfected easily have to be removed from this place. I would suggest, except the seats. We need to remove everything else. We usually keeps some uh, magazines, magazine stands, and side tables and things like that, which are potential sources of infection. The patient waiting area should be well ventilated and mostly by using fans and the exhaust, and try to avoid air conditioners. If at all really you require a air conditioner, HEPA filter is something which we have to think of using it. This is how I would say an ideal reception counter can be, by providing a glass cover, something like this, and we can use bins, waste paper bins with a foot handle these bins. So